Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Vikas Punamiya. Dr. Vikas Punamiya is a senior medical professional with over 2 decades of experience. He is currently attached to the Breach Candy, L Raheja, Gleneagles Global, and the Masina Hospital as a consultant pulmonary and sleep physician. Dr. Punamiya is an internationally trained doctor and has been associated with several leading international institutions such as the Birmingham Heartlands Hospital in the UK, the Lancaster Hospital also in the UK, the Hornsby Ku Gai Hospital in Australia, and many more. He has a special interest in the speciality of sleep medicine and has completed his fellowship in sleep medicine from the Birmingham Heartlands Hospital. Dr. Punamiya has attended several conferences and workshops across the world and has been invited as a guest speaker by reputed medical institutions of the country. He has also worked on a host of research papers that have been published in peer-reviewed medical journals. Dr. Punamiya is a reputed member of various international and national associations such as the American Academy of Sleep Medicine, World Sleep Society, American Thoracic Society, the European Respiratory Society, and the Indian Association of Bronchology, amongst others. Welcome to Health Live at Seniors Today, Dr. Punamiya.
Thank you very much. Thanks for having me here.
You know, readers, I must tell you that we were reaching out to Dr. Punamiya a few weeks back, and that's when the current pandemic was raging, and he obviously, whenever we request a doctor to come here, the focus is, of course, on ensuring that their presence here doesn't take them away from patients. And so that's when we said that, it's perhaps a better idea to get in, to ask him to come in later. And Dr. Punamiya, how's the scene now in the various hospitals that you are attached with?
So I think COVID per se, this time, fortunately, what I can say is that we're seeing milder cases. And though the case numbers are much higher, where almost families are all being affected, but most of the patients are having quite mild symptoms, and which is why the hospital admissions are not so much because of COVID. But what is happening is a lot of patients are coming with different ailments and incidentally being found to have COVID as well when they're getting tested. So which is why the COVID wards are still almost 50% full. But it's mainly not COVID related issues, but rather a incidental finding of COVID in a patient, say, of having a heart attack or a stroke or some other medical illness. So I think from COVID perspective, at least things seem to be looking up, but I always feel it's never too, so it's not good to let your guard down too soon. So I would still want to keep the precautions of masking and everything in and social distancing in place, because what we've seen with COVID and the coronavirus over the last 2 years, and one thing that I think we should have learned by now is that it tends to rear its ugly head when we least expect. So I think I would say give it another month or so at least to understand how this pans out. Only then I think major decisions like unmasking and social distancing should be taken. I know in UK has done the unmask. Have decided to go without the mask, uh, but I think we should we should take it slow because our population is much higher than what theirs is.
Right. I clearly the thing is, as you said, it tends to show its ugly head when you least expect it, and this is what we've seen in the last 2 years. In fact, it's almost going to be 2 years
Yes.
since the pandemic struck us. And uh, but tell me, doctor, how do you take care of yourself? You go to various hospitals, and you are the front line, and because you're treating patients with lung ailments. Obviously, you are on the very much on the front line.
Yes. So as I said, the most important thing is to mask, and especially when I'm in the hospital, I make sure I'm wearing an N95 mask. Sometimes nowadays even, sorry, double masking if required. That is the most important thing, and washing hands as frequently as possible. We do all that initial furor about surface transmission and all that is out of the picture. There's no evidence to show that there is surface transmission. So all these things about sanitization and all that, I think that's a bit too stretched. And I think it's just something which has sort of become a habit. And now even I know a lot of buildings still continue to do sanitization, which I don't see any reason to waste time and money on.
But masking and hand hygiene is what you
Absolutely.
recommend. Anything special that you would think for senior citizens, especially that you would like to suggest?
I think, yes, avoiding crowded places, especially functions and marriages. What we saw in this third wave is a lot of patients came because of being infected with by after attending major crowded functions, and unfortunately, that is a part and parcel of our culture where we have very large weddings, and it is something that we still need to be very careful about.
Yes, crowded places. But one of the other problems that happens is, and especially in cities, in the large cities, is that you don't have domestic help, full-time domestic help. The domestic help keep coming in, and they are coming in from wherever they live, and you also have door deliveries, etc. And
Yes.
how do you really take care of that? And
So you just need to be careful. So make sure that anyone coming to your house is not unwell. Make sure the maids and housework who is coming is they've been fully vaccinated. They're not no one is unwell. Make sure you're fully vaccinated. That is very very important. Uh, that is, I think, and as per the guidelines, as your time comes for taking the booster, please go ahead and take the booster dose as recommended by the medical faculty. I think those are the most important things that see. Ultimately, life has to go on, and we will not be able to stand still and not do anything. So I think we have to be as cautious as possible without it taking over our lives at the same time.
great. Thank you, doctor. This is outside the purview of the topic that we have, which is sleep apnea. And over to you, doctor, for your presentation. Those of you who have questions, please put them on the Q&A tab with your gender and your age, because then doctor would be able to give you a more considered reply. If you don't want to give your name, you can always ask the question as an anonymous attendee, but please do mention your gender and age. Over to you, doctor.
Sure. Just to clarify, what we're going to talk about is not just sleep apnea. We're going to talk about sleep as a perspective of sleep itself. Okay.
Right. Yeah.
I'll just give me 2 seconds. I'll just share my screen. Okay. Can you guys see my screen?
Yes, we can see it. We can see it.
See the presentation? Okay. All right. Okay. So breathe well, sleep well. That's my motto. That's the company that we made. Tired of being tired, a perspective of sleep. That's our topic for today. Okay. Um, I'll sleep when I'm dead, said Warren Zevon. He's a rock star, was a rock star who died very early at 56. Ultimately, death will come sooner when sleep is sacrificed. Okay. Just before we actually start the presentation, there are two surveys that we conducted. This is almost 3 years back, before the pandemic struck. And the first one, this one is basically a survey of 100 doctors over 3 hospitals that we conducted to understand their understanding of sleep and sleep related problems. And less than 50% were able to score more than 13, which would have told us that it's a good awareness. Okay, this is a another study that another survey that these are both internet-based surveys. There's another survey which we carried out amongst the normal public, and here we had 95 responses, and over 40% of the patients, they scored more than 5 out of 10. Uh, this is a survey which gives us a probability of someone having sleep apnea and needing evaluation. And more than 40% of the patients fell into that category. Okay? All right. Uh, this is a cartoon which hopefully tells us a lot about sleep deprivation. Okay, as a good friend of mine once said, this is one of those things that's only funny if you were not sleep deprived. Okay, quality sleep. Quality sleep is essential for good health and overall quality of life. Okay, sleep allows our body and mind to recharge, leaving you refreshed and alert when you wake up. Now, chronic sleep deprivation has become a bane of our modern society, and it has actually become a big public health problem as well. Okay. Uh, if if I am not mistaken, most of the companies, most of our major employers, they always expect their employees to be working long hours, and for decades this has been the case where they equate good work with long hours of with the employee putting in long hours of work. However, they have not realized how counterproductive this is. Perhaps the reason why coffee is one of the most sold commodity after second most sold commodity, sorry, after oil, is the fact that most employees survive on large cups of coffee while working long hours and sacrificing their sleep. Uh, this is just the uh, obvious loser, in this cycle of life is hence sleep. This is the sad truth of sleep deprivation, and it is an issue which is often ignored. What happens to our brain, when we don't sleep? Without enough sleep, the brain cannot function properly. This can impair your abilities to concentrate, think clearly, as well as process memories. It also is a risk factor for cognitive decline, and deprivation as well as sleep apnea both have been documented to show to be risk factors for causing early dementia. How does sleep affect your heart? Sleep sleep deprivation will is a major cause of high blood pressure, irregular heart rhythms, stroke, heart failure, as well as abnormal cholesterol. It also affects you with diabetes and obesity. It Sleep apnea itself is known to be a risk factor for type 2 diabetes as well as impairs the diabetes control. Researchers have also found that sleep deprivation can impact your sex life. It leads to a decreased sex drive, lower fertility, and even erectile dysfunction. 50% of men having sleep apnea are likely to have erectile dysfunction. Obviously, it hampers your marriage. Quit snoring, a major problem, which is usually because of the sleep apnea. Loud snoring can keep not just you, but from getting a good rest, but also your partners, and eventually it can disrupt relationships. It is not uncommon for people to choose their partners to choose to sleep in other rooms because of this. Sleep deprivation, you remain tired and sleepy during the day. It causes excessive daytime sleepiness. Uh, Most people will also result in decreased productivity because of this, and actually it can be a cause of road traffic accidents as well as other dangerous accidents during your work, which we will see in a few slides as well. Dangers of sleeping at work. I don't think any of us wants to do that. Uh, Cost to the employer, lost hours by sleeping at work, sleeping on the job. You're more likely to get caught. You can't sleep? Please pretend you're in your office. Are you implying I have a snoring problem? Okay, this is a tragedy that I wanted to touch upon. This was a major uh, rail accident, metro rail accident in New York. I think it was the first metro rail accident in 2013 when the train on the Metro North Line crashed in Bronx. It took the turn too fast and slip off the rails. The cause of the accident was determined to be that the engineer, later on, it was determined that the engineer who was driving, the driver, was suffering from sleep apnea and he had nodded off while at the wheel. And because of that, he'd taken the turn at least 3 times faster than what he should have. And because of that, causing a huge derailment and almost 60, I think 44 people died and 63 were injured. This report actually resulted in the federal railroad authorities setting in a requirement that all public anyone who is driving public vehicles in the US needs to be screened for sleep apnea, which includes truckers, train drivers, um, bus drivers as well. Unfortunately, we don't have anything like that in our country, you know. How many hours of sleep do we need? Uh, so as an infant, when we first are born, and where the sleep ranges from 12 to 18 hours, the requirement starts coming down to as a teen, you need at least 8 to 10 hours, while as a adult, you need at least 7 to 9 hours. And most elderly people can make do with at least 7 to 8 hours of sleep. But are we really getting that much? Is the major, and getting it is one of the most major issues. Most people sleep during the hours that make most sense for their professional, family, and social commitments. Their awakening times are largely determined by their responsibilities and commitments, whereas when they go to sleep will be determined by their personal preferences and evening activities. Now, most adults, as I said, need at least 7 to 9 hours of sleep per day. That's a given. Now, figuring how to get that is the important question. The best way is to check your time which you need to wake up. Say if you have to get up at 7, then count 8 hours backwards and set a bedtime of around 11 o'clock. Some people, as we all know, are larks, which is the morning types, so they sleep early and get up early, while there are others who are owls, and those are night lovers where they sleep late and tend to get up late. Still, others are obviously anywhere between these patterns. What you are will depend on your individual circadian rhythm. This is the rhythm which determines your sleep times. It's a 24-hour internal clock, okay, that regulates sleep, awareness, alertness, and other bodily functions like temperature. In other words, there's no magical one size fits all. We just need to find out what works best for us, but making sure that we try and get our 7 to 9 hours of sleep per day in that. Uh, Optimal windows of opportunity for sleep are ideally between the evening hours of 8 p.m. to 12 a.m. Uh, some people ask me, is napping good? Now, while napping isn't a replacement for lost sleep, it can help you feel more rested during the day. It is actually very helpful for people who are not able to keep a similar schedule for sleep, and also for shift workers. Even a short power nap can actually refresh you for the rest of the day. If you take a nap, please keep it brief. Also, make sure that you do not nap after 3 p.m. because that will definitely affect your night sleep. Okay? going forwards. What are the common sleep disorders? So the most common sleep disorders, sleep is a it's a broad specialty, and now we're seeing so many disorders which may be related to sleep. But the most common sleep disorders, I believe, are obstructive sleep apnea, insomnia, as well as restless leg syndrome. But believe me, one of the biggest sleep problem, according to me, and I think most people, most sleep physicians would agree, is just poor sleep hygiene. Okay, we will talk a bit more about all of these in a bit as we proceed. Um, okay, now what causes sleep? What are the common causes, of sleep disorders? Uh, it could, like, why would my sleep be disturbed? And it could be because of physical, such as chronic pain, which can cause you to have poor sleep, chronic back pains, chronic knee pain, and those can all affect your sleep. Medical, such as asthma. Asthmatics actually tend to wake up with severe attacks actually in the middle of the night, okay, if it is poorly controlled asthma. Psychological, such as depression, anxiety disorders, can also affect your sleep. Social, such as alcohol. Now, most people believe that, oh, I've had alcohol and I'm going to sleep well, but that's not true. Alcohol may induce sleep, but the quality of your sleep is hampered and it worsens. And especially in people who have sleep apnea, it actually worsens the apnea. It worsens the disorder itself. Uh, Working the night shift, work schedule messes up the biological clocks. Genetics, narcolepsy is a genetic disease. I'm not going to talk much about it because it's very uncommon in India. It's the incidence is 1 in a million. So I think for today we will let it be. Medications, some of which interfere with our sleep, and aging. Half of all adults over the age of 65 may have some sort of sleep disorder. It is not clear whether this may be just part of normal aging or a result of the polypharmacy that most of our elderly population is on. If you see the medication list, and as I have been actually during COVID, I realized this. When I ask people to send me their medication list, especially in the elderly population, what we see is a list of not less than 5 to 10 medications covering blood pressure, diabetes, and various other medical disorders. Um, how do you recognize whether you have a sleep disorder? So, if you are having a regular difficulty with getting to sleep or staying asleep, if you feel so tired that even after a good night of sleep, you wake up feeling tired, you feel unrefreshed, and you're unable to function normally during the day. If you have a problem of snoring, and I mean the loud variety, believe me, I'm going to tell you one story. I had an aunt, actually my dad's aunt, my grandfather's sister. She used to, when she used to visit us, she used to snore, and she used to snore so loudly. We actually nicknamed her Lion Wali Bua, because the snoring was so loud that there was no possibility of anyone being able to sleep in that room at all. So today, and she was a person who actually died at an early age because of medical problems like blood pressure, heart disease, and diabetes. Today we recognize that snoring was actually a sleep disorder which was unrecognized in those times. Um, Falling asleep at the wheel while driving, or even when you're at the traffic lights, say for a few minutes, you may nod off, and someone's honking at your back. Struggling to stay awake when active, such as when you're watching television or reading, where you're not really active, and there you struggle to sleep or you nod off every now and again, and your wife is nudging you or your husband is nudging you to stay awake during the movie. Having difficulty paying attention or concentrating at work, school, or home, or even having poor focus. often told by others that you look very sleepy. Frequently waking up in the night to use the loo. This is so prostate is not just one of the reason is not the only reason why people why people wake up frequently. Sleep apnea has been shown to be quite prevalent in people who face nocturia, that is, waking up at least two or more times in the night to use the loo. Having difficulty with your memory, having slowed responses, or being unable to focus, being more and more forgetful of small things, uh, having difficulty controlling your emotions, becoming increasingly irritable, shouting, or losing your temper on small things, needing to take long naps almost every day. There's a short video we're going to run. This is a video which shows you what happens during sleep apnea. Okay, um, so I'm just going to start. Let's hope it starts. Yes.
Sleep apnea is a common disorder in which there are one or more pauses in breathing or shallow breaths during sleep. Normally, without sleep apnea, your airway remains open. Your airway consists of your nose, mouth, throat, and windpipe. This allows the flow of air and oxygen into your lungs when you inhale, and the flow of carbon dioxide out of your lungs when you exhale. Obstructive sleep apnea can be mild to severe. Your airway may narrow or close completely. When the airway collapses a little bit, the airway becomes partly blocked. This makes it harder for air to pass into your lungs when you inhale. Any air that squeezes through the blockage may cause snoring. At times, the airway may become completely blocked where there is no airflow. This is called apnea. With little or no air flowing to the lungs, there is a decrease in blood oxygen levels. This signals your brain to disrupt your sleep, which helps you open the airway. Sometimes, obstructed breathing ends with a gasp. The normal breathing cycle continues until the next episode of obstruction. Episodes may last seconds to minutes and recur 1 to 100 times per hour.
Right. So, as you saw over there, where the airway is getting completely blocked or narrowed to the extent that the flow of air is reduced, that is what causes obstructive sleep apnea. Okay. In this, the oxygen levels drop, and it is a major cause. It is an independent risk factor now, known to be associated with high blood pressure, diabetes, uh, strokes, heart disease, as well as people with sleep apnea, having moderate sleep apnea, are known to have brainwave patterns which are very similar to early dementia as well. Uh, Patients may present with excessive daytime sleepiness, snoring, mouth breathing, irritability, loss of focus, forgetfulness, and waking up frequently in the night because of the need to go to the loo. It is common in almost 25% of males and around 10% of females. Insomnia. Insomnia is another sleep disorder which affects almost 35% of the adult population. It is marked by problems of getting to sleep or maintaining sleep or feeling unrefreshed whenever you wake up from sleep in the morning and you are unable to get a restful slumber. It can have serious side effects leading to excessive daytime sleepiness, um, irritability, higher risk of auto accidents, as well as widespread health effects from sleep deprivation. Common causes of insomnia are mainly stress, and basically it is an having an irregular sleep schedule, poor sleep hygiene, I think, is one of the major, and poor sleeping habits. That is one of the major causes of insomnia. Also, the fact that you start being afraid of going to bed because you're not sure whether you're going to get sleep, and that cycle sort of becomes like a vicious cycle, so you, every time you go to bed, you're only overthinking of trying to get to sleep, and that becomes a major problem as well. um, how do we what do we do, how do we diagnose? Now, first of all, it is very important that we recognize and accept that there is a problem. Okay, I think the biggest issue that I feel is currently there is that most people feel that sleep is a given, and they get used to whatever sleep they are getting, and they feel that it's just part and parcel of life. Snoring is never is actually, people used to think that loud snoring means, oh, the person is sleeping very soundly, but that is not actually true. Um, so recognizing and accepting the problem is very important. I think all our family physicians, people who our patients go to as the first line of treatment, should at least spend 5 minutes discussing their patient's sleep. And if they have any issues, and they should make a point to ask them targeted questions about their sleep. Uh, Seeing a sleep specialist once you have recognized a problem, what do we do? We basically need to be able to take a good medical history as well as a very detailed sleep history. We may advise you to get a sleep study done, which may be either in a sleep lab or a home study. The sleep lab studies are obviously much more comprehensive, they're video recorded, they obviously give us much more information compared to a home study. Uh, but sometimes a home study may be enough, and I think that's a decision that the sleep physician needs to take. Okay. So, what are the things that you can do to help you go to sleep? So, first of all, as we see here, at least 6 hours prior to going to bed, you need to stop drinking any form of caffeine. Alcohol should be stopped at least 3 hours prior to going to bed. Make sure you're not having a heavy evening meal. Uh, Try and finish off your meals at least 3 hours prior to bed. Even heavy exercises should be avoided late in the night or late in the evening after 7 o'clock. Ideally, doing a walk or something is all right, but leave your heavy, vigorous exercise for earlier in the day, either in the mornings or early evenings. Okay, the most, and obviously stop working, studying, or stressing at least an hour. Make sure you create a calm environment before you go to sleep. Create a daily routine. Uh, how do you do that? You could probably play some calming music. You could read a book. You can use an e-reader if you can do without bright lights to illuminate the actual book. Um, Turning off electronics, one of the most important thing, and I can't emphasize enough. Um, all of us are guilty of this, I'm sure, where we use our phones or our tablets late into the evening, late into the night, probably even in our bed, and we probably have televisions in the room. I feel a television in a room is a curse. I think you should take it out and get it out of the bedroom. It should never be there in the bedroom. Make sure you turn off your phones, your blue lit devices, like any blue, so iPads and all that should be stopped used before, at least an hour before you go to bed. Okay, that's very, very important. Um, it is Other than this, the woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep, and miles to go before I sleep. This was said by Robert Frost. Your future depends on your sleep, so please go to sleep. Thank you for listening. You can all wake up now.
Thank you. Thank you very much, Dr. Punamiya.
Thank you.
An excellent presentation, very detailed. and I guess it captured everything very well. We have quite a few questions that have come in, and there's one of it which is a jest, which I wouldn't like to bury under the carpet, but I wouldn't name the person whom they're referring to. Says there are some political leaders who claim that they're sleeping for only 4 hours and still they're fresh, hale, and hearty and healthy. And we've heard over the years that we've had political leaders who say that they've hardly slept. Now, obviously, this is not a virtue that you should be proud of, or it is not even a habit that you would. So, is there something that you would like to say on that?
Even I can tell you, there was a time during my medical residency, I used to be proud of going without sleep for more than 24 hours at a time sometimes, where we used to do our residency. Most medical residents probably do that. And I think in a recent this conversation with a sleep colleague, when I mentioned this, that how most medical residents, they do with very minimal sleep during their residency. He said they manage, and it's a very short period of their life. If you do that continuously throughout your life, you will definitely start seeing the ill effects of the same. So, yes, doing it for a few years where it's a necessity or it's a compulsion, where I think even now if you see, California has actually changed rules for school starting times. They have made it mandatory that schools cannot start before 8:30 in the morning, so that the children can get adequate sleep at night. So I don't believe when people tell me that, oh, I sleep for 4 hours and I function to my full potential, then probably you've not realized your full potential, is all I can tell you. So sleep is a commodity which should be valued, and I think it is something that you need to be more particular about. You have to be very careful. It is almost worth its money in gold. So it's worth its value in gold. You don't want to ill spend it.
Absolutely. Thank you, Doctor. We have quite a few questions that have come in. So I'm going to go one by one and perhaps look at asking the one which we received first.
Sure.
So this is by Madhusudan Bhandarkar, who says, I'm 69. I get up in the night twice or thrice to go to the washroom, after which it takes quite some time to get sleep. Is it due to age or something else? But I get sound sleep in the daytime. Can you suggest some remedy for it? For my age, how many hours of sleep is necessary? He said he's 69.
Right. So do I need to press answer live or something? No.
No, I'll do that.
All right. So basically, Mr. Bhandarkar, the thing that you need to do is, one is obviously daytimes. If you are having excessive daytime sleepiness, it means that you may be having a problem at night. Okay. One is obviously whether it may be related to your prostate. That is something that we should review and getting a PSA done. But more importantly, if that all is normal on that front, I think you should get yourself at least seen by your family physician to get him to evaluate your sleep. And if not, then see at least a sleep physician to at least get an evaluation of whether whether you may be suffering from some sleep disorder which is causing this problem. I hope that answers his question.
Yeah, doctor, but in one of the bane of the current era is the absence of the family physician, right? In a city like Mumbai, there are very few family physicians around.
Very true.
And so one ends up visiting a specialist for most of these things.
Exactly, I agree. I unfortunately, I don't think we're going to have a solution to that problem, because as things are getting more and more modern, I think less and less residents want to actually specialize in family care. People want to be specialists. People want to create their niche. So I can't fault them. And
plus, real estate is so expensive. So
exactly.
We have a question from Saroj Kakkar. She's age 75. She sleeps at 11 p.m., wakes up 2-3 times in the night, and by 5:30 p.m. she is up. Her question is, shall she take a sleeping pill?
No, as I said initially in my talk as well, do not rely on sleeping pills. You should always evaluate why you're s- not why your sleep is getting disturbed or why you're waking up, and it may be some inherent sleep related disorder which may be a cause. As I mentioned, sleep apnea is one of the most common causes for nocturnal waking up to go to the loo. So I think that is something that needs to be evaluated, and only then, under proper guidance, should any sleeping pills be taken. Okay,
Right. Thank you. We have a question.
that too very very reluctantly.
Right. We have a question from Mr. Bharat Bhadeka, who's
Mhm.
69. He's retired and suffering from blood pressure and diabetes. He
Right.
has no reason for anxiety, but has anxiety. And he takes a sleeping medication of 1.25 milligrams and 3 milligrams,
Mhm.
natural medication.
Right.
And he's under a treatment of a neurophysician and a cardiologist. I guess he's just asking for advice.
What I want to understand is what does he mean by natural medication? Because obviously I cannot advise you on whether because sleep medication. When you say natural, what does that actually mean? Is it possible for him
So
to?
perhaps, Mr. Badeka, if you are still, if you're online, if you can tell us what you have, then in the next 15 minutes, when doctor is here, we would ask that question again.
Sure.
We have a question from Mr. Surinder Mahajan, who's 76.
Right.
He has a sleep problem a few months back. As per the advice of his doctor, he took Nexito Plus tablets for about 2 months. Subsequently, the dose was decreased to half a tablet for about 2 months, and then half a tablet on alternate days for about 5 weeks. A few days ago, he again had a problem of sleep and had to take half a tablet.
Right.
Kindly inform whether excessive use of Nexito Plus will have side effects.
So as I already said, I think any sleeping tablet for that matter, and Nexito Plus is a combination of medications, actually anti-anxiety as well as sleeping medication. And I am personally not in favor of sleeping tablets as far as we can avoid them. I think you need a further evaluation as to why you're waking up, and only then, if your doctor, please do not take tablets because your doctor had told you last time that you take this time also. It is always better that if you have a recurrent problem, to please approach your doctor again, to understand whether that would be the right thing to do. Any medication, any drug that you take, say even paracetamol for that matter, if taken inappropriately, can have side effects. So I think it is very important to have doctor guidance whenever you're taking any medication, and especially medications which involve sleep and anxiety.
Doctor, from what you've told us,
Mm-hmm.
clearly while going to a physician is important, but if one does have a sleep disorder, it is
Yes,
important to visit a specialist like yourself.
I agree.
Now, many of our people are not in Mumbai. Do you, for instance, do
We,
teleconsults?
we do teleconsults. So actually, in the last 2 years with COVID, I think teleconsults have become almost a norm for most people. Yes, sometimes I do prefer to see patients so that we can examine them as well. But if it's entirely not possible, then at least we do the teleconsult, advise them accordingly. If required, we try and organize for them to have a sleep study in their own town, and then evaluate the findings and take it further from there.
So I'll also address this question by Ketan Kapadia. So the edited extracts of this video will be there on seniorstoday.in on Monday morning. And along with that, we will also have doctor's coordinates, the telephone number and email address of his clinic. And perhaps those of you who do want to refer to him can approach him, or perhaps they can advise a doctor in your city or in your locality. Uh, Doctor, we have a question from Pradeep Nigam, and I guess this is a question for various others. He is 73 and asks, how long does it take to cure sleep disorders or
So,
apnea?
so sleep apnea itself is a problem. So basically, it is a problem more common in patients who are obese. If you are able to lose adequate amount of weight, then it is possible that you may get cured of sleep apnea. Otherwise, the treatment is basically it's a mechanical problem, as we saw in that video, and which has a mechanical solution, which is basically positive airway pressure machines, which help to keep basically create an airway splint and help to keep the airways open during the night and maintain the airflow throughout the night. Um, I didn't touch on the treatment aspect of sleep apnea, and I'm more than happy to. So basically, it's a what happens is in sleep apnea, all the muscles in our neck, in our body relax, and so do the neck muscles. In some people, these become so floppy, they flop over each other and cut off the airways. The solution is basically a positive airway machine which sits near your bedside with a pipe and a mask at the end of it. The mask is what you need to wear during the night, and the machine throws air under positive airway pressure, and that acts as an airway splint, keeping the airways open throughout the night during breathing in and out, so that the airways cannot flop over each other and the brain continues to get the oxygen it needs. Unfortunately, because it's a mechanical problem with a mechanical solution, until you actually are able to create a situation where your muscles become more taut and they don't flop over each other, which is basically by losing significant amount of weight, you will have to use the machine continuously, probably even lifelong,
Right.
whenever you sleep, basically.
Thank you. We have a question from Katie Dadanchi. Her question is, Doctor, are adenoids a cause for snoring and sleep apnea? My husband and I are in our 70s, and we get up once or twice at night to the loo, and hence our sleep gets disrupted. And after that, we don't get 8 hours sleep thereafter. Is it okay?
So, well, it is not okay to get less than 7 or 8 hours of sleep, obviously, as we already spoke. The issue with adenoids is more commonly seen in childhood, where childhood, the 75% of the cases of obstructive sleep apnea are because of adenoids. And probably surgically removing them may be the solution in most of those cases. In the elderly, it is not so often the case. Light snoring is something that most of us do, and that is not something that I would be overtly concerned about. But the snoring that I mentioned that you have to be concerned is loud snoring, disturbing your partner, or even sometimes heard at the door to someone who is standing at the door outside your room.
Thank you. We have a question from Pradeep Nigam, who asked, does the machine cure?
So, as I said, the machine it solves your problem for the time you use it. There's no cure for sleep apnea as yet. There's no permanent cure. There are other modalities of treatment, including surgery. The reason I don't push people for surgery is basically because surgery is less than 50% of the cases are successful. And if it is not successful, using the CPAP is much more painful and difficult. So, which is one of the reasons why I don't recommend surgery.
Right.
There are other modalities, one of them which is not available in India called Inspire, which is basically like a pacemaker and in the neck with a lead to your neck muscle. But again, that these are all recommendations only if you're not able to use the machine appropriately.
Right. We have Mr. Bharat Badeka telling us the natural medicines that he's had, which is 3 milligrams of Melocet and quarter of 5 mg of Zolfresh medicine.
Right. So first of all, let me be very clear. There is no natural medicine. Melocet or Zolfresh, both are not natural medicines. They are allopathic medicines. Okay. Secondly, I think his problem was, in spite of taking this, he was breaking. His sleep was breaking.
He said he's a man of 69 years. He's retired. He has BP and diabetes, but no anxiety, and he is taking these natural medicines. He calls them. So, he's under treatment of a neurophysician and a cardiologist.
So neither of these two medicines are anti-anxiety. Okay, neither Melocet nor Zolfresh. They're both sleeping tablets. Secondly, 1/4 dose of Zolfresh is like either just taking a mint tablet. I would rather he not take it. It's not going to give him any benefit whatsoever. Okay. So the minimum dose that you take of Zolfresh is 5 milligram. But as I said, if you need to get the right advice from the right person for this.
Right. Thank you, Doctor.
Sure.
There's a question from an anonymous attendee, and you've answered that in a sense. It is, I watch the news until 11 p.m. and go to bed at 11:30, and then stay awake for hours. She is 75.
I think we've answered that
Yeah,
in
obviously,
depth, you know.
if you're watching the news for so long, then you have things to worry about.
Yeah.
So, okay, we have a question from Mr. Krishnamurti Iyer, and this is an important question because a lot of people, a couple of other people also asked this question. Is there a special way of the way in your furniture should be positioned? His question is, how should the bedroom be positioned for getting a good sleep? Is it, when mostly all the doors and windows are shut?
The important thing in your bedroom is that one is you have to have a good mattress, comfortable mattress, which you are comfortable with. You have to have the right temperature, not too cold, not too hot. Cooler temperatures are obviously better for sleeping. Make sure that your surroundings are quiet. You don't have any noise. Make sure the room as dark as possible. These are the things. Other than that, there's no per se recommendation for how your bedroom needs to be positioned. These are the things that I would recommend with regards to your bedroom.
Is a night light a good thing to have or not a
So
bad?
nightlight, so as I said, having complete darkness is the best thing to have. But if you absolutely have to have a nightlight, the best color to have would be to have a red light because that doesn't impact your sleep. Any other colors, your white light. So one other thing I forgot to touch upon was the LEDs. Most of our homes now have LED lights. uh, your LED light is almost as good as sunlight in disturbing your sleep, and it can make your brain think that it is still daylight. So you need to make sure that when you in your bedroom at least, either you try and avoid having LED lights or make sure that they are dimmed uh, enough during the night so that you are able to go to sleep better. And try not using LED lights at least for reading at night.
Right. Doctor, I knew the question like this would come when you spoke of a mattress. So we
Right.
have a question from CA Pushpa Shah, who asks, which type of mattress would you recommend?
I don't recommend mattresses.
But is there something that one should look for
I
in terms
basically
of,
put what is comfortable for one person. I think it is a very individual choice. I don't get into this recommendations. Basically, what I do, I can just tell you what we do at our house is we have got a foam mattress, and overlying that there's a 6 inch or 8 inch I think foam mattress, and overlying there's a 2 inch of cotton mattress, and I get peaceful sleep on that. Is all I can tell you.
right? Thank you. Uh,
I don't recommend taking an orthopedic mattress or this mattress. I don't get into that. Sorry.
Absolutely. I guess that's a good indicator of
Yeah.
what things are. We have a question from Milan Mehta who says, Doctor, is high cholesterol also responsible for sleep apnea and
Rather
snoring?
than high cholesterol being responsible for sleep apnea, it would be more the other way around, where sleep apnea could be responsible for the high cholesterol. So sleep apnea has been known to have impacts on the heart as well as poor control of cholesterol and things like that.
Right. Doctor, we have one or two more questions.
Yeah, sure.
Um, well, there are questions about the same. Anil Shah says 70, 77, get sound sleep for about from 12 to 6, but have snoring problems. There's somebody else who's just 43, but who says, how can one come out of snoring?
Okay, so first is recognizing whether it's just snoring is the major issue or whether it is more than snoring. If it's just snoring, there are certain ways where you don't need to use a CPAP machine at all. Okay, what I know, so if snoring is loud enough to disturb your partner, but it is not significant enough to be causing you sleep apnea, then what I normally recommend is going to a dentist to get what is called a mandibular advancement device. It's very similar to the night guards that they recommend, but instead of the night guard, which actually pushes your jaw backwards, in this case, the advancement device pulls your lower jaw forward, creating a bigger area, and so that the amount, so basically to reduce the amount of snoring. Just to touch on that point as to why snoring occurs, is snoring occurs when air is passing through a very narrow uh, tube and a narrow airway, and the vibration that occurs, that sound is transmitted as snoring, and the narrower the airway, the louder the snoring.
Right. We have a question which is interesting, which is not from a senior citizen, but
Yeah.
uh, the person says she is 36, but sorry to be here in this specific target audience, but I don't feel a lot of people my generation will live long enough to be senior citizens.
I
Thanks
hope
to
not.
city work and
I hope that is not the case. I am sure most of us, with the times and medical advances, I'm sure most of us are going to live long
absolutely.
lives, and
Uh,
we need to make sure that we live better quality of lives.
Now, the question which she has is I want to know whether sleep apnea can deprive the brain and heart of oxygen for enough
Absolutely.
time to completely stop its functioning? Or do we always wake up when it happens?
So as I said, it reduce. So every time an apneic episode occurs, the oxygen going to the brain is reduced. Your oxygen, which we measure on a saturation probe, reduces by a minimum of 3 points. We have had patients whose lowest oxygen levels have gone down to almost 68 to 76% during the night. We've had patients who've had episodes almost anywhere ranging from 20 to 100 episodes per hour every night. So just imagine if within an hour, if you were to have, say, 40 or 50 episodes, each lasting at a minimum of 10 seconds each time, how much oxygen deprivation are you having? It's just a logical thinking. So, which is why treating sleep apnea is very, very important, recognizing it and treating it.
Also, we have a question again, not from our core readers, who's 49, but the question is important. So he has done three surgeries. He's 49, Praveen: septoplasty, pharyngoplasty, and UPPP.
Yeah.
That is uvulopalatopharyngoplasty
Pharyngoplasty. Yeah.
with coblation inferior turbinoplasty, all together in a suburb in Mumbai for his sleep apnea. It has helped him for 6 months only. Then I had to go back to my CPAP machine. I still wear CPAP machine. I have this OSO issue since 2016. That's when I get diagnosed with CPAP, sleep study, and sleep endoscopy. My AHI is uh, at that time was 28.4. Please guide.
So that's what. So as I said, I my first recommendation for sleep apnea is never surgery. It's always CPAP, and this is a prime example of why that is the case, because most times surgeries are not they're not successful, and and sometimes using the CPAP after that can be quite painful, because all of that area where you have had surgical operation, surgery, when the air is hitting at the back of your throat, it can be quite painful. uh, I hope that I don't.
Yeah, yeah,
He
and I
probably
think
needs a further evaluation to
yeah.
understand why he's still not benefiting.
Doctor, there's a question from Daksha Lakhani, who says, I have a sleep problem since a year and a half after my husband passed away.
Right.
I'm taking etizola since then, and I have BP and sugar, but taking medicines, it is under control.
Right.
She doesn't have any specific question, but is there an advice that you could give her for a sleeping problem?
I think sometimes meditating make a few things that I forgot to mention actually for sleep hygiene is one is, as I said, creating a sleep routine is very, important. Making sure you have a routine just before going to bed. Also, taking a hot water shower 2 hours prior to going to bed, it helps the muscles to relax, and as your body cools down, it sleeps better. Making sure your room is free of all electronic items. You do not have a television. You make sure you've stopped all electronic gadgets at least an hour prior to going to bed. Making sure your lights are very dim. Also, make sure your bed is only for two things: sleep and intimacy, and nothing else. Don't bring your work to your bed. That is very, very important. Okay. Uh,
Any exercises that you would recommend? You spoke about meditation.
yeah.
Some people have in the past spoken about the fact that when they exercise and they go for their walks, their snoring reduces a bit.
Snoring does not reduce because of exercise. Snoring will only reduce when you lose weight in the long run. Snoring will definitely get better because as you lose weight, your muscles get taut, okay, and they then don't flop over each other. So, yes, but exercise just before sleep, walking is all right, but don't do any heavy exercise because that stimulates the body. And when your body is stimulated, it is going to have difficulty falling asleep.
Right. Thank you, doctor. Quite a few questions that have come in,
One
and
one last thing also before I forget is do not toss and turn. If you are not getting sleep within the next 20 minutes, get out of bed, probably take a walk, read a book, do something that calms your mind. Make sure you read a book which is a dull book. Please don't read exciting detective novels where you get excited by the story and then start thinking about it. So read something which is very dull. I normally pick up my medical book and start reading it. It puts me to sleep very well. So make sure you take a dull book to read, and then try and go back to bed. Okay, because if you go toss and turn, you just, as I said, you just start overthinking about your sleep, and that sometimes can become a vicious circle and of creating chronic insomnia.
doctor, you mentioned. I have a question. You mentioned about a hot water bath
Yes,
2 hours before you go to bed. Now, is that after dinner or before dinner?
preferably after dinner. So I always advise having an early dinner at least 3 hours prior to sleep, bedtime.
So 3 hours uh, prior to sleep, dinner, 2 hours prior to sleep, a hot water bath, and 1 hour before sleeping, curtains down.
Exactly.
Great. On that note, doctor, it was a pleasure having you here. We've addressed quite a few questions. There are still some questions coming in that just shows the kind of hunger for information on sleeping disorders and sleep apnea. We will perhaps have you once again in a few months from now.
My pleasure.
Um, those of you who have questions, uh, uh, who have asked questions and who have similar questions which we've not raised, please do look up the edited extract from the video from this recording, as well as the takeaways that we capture every Monday on seniorstoday.in. And that will give you a detailed idea of what was spoken about. And we'll also mention the coordinates for doctor, his telephone number and email address, in case those of you who wish to reach him can do that. Thank you once again, Dr. Punamiya, for this session.
Thank you very
And
much
it
for
was
having
a
me.
pleasure having you here. And
Thank
we'll be back again next week, that is next Saturday on Feb 5th at 5 p.m. for our next session of Seniors Today Health Live at Seniors Today. I was going to say Seniors Have Talent, which is our program on singing, which has just concluded last week. So we will be back again for Health Live at Seniors Today. Doctor, I'm going to just take a minute of yours, and
Sure.
I'm going to request our producer to play our video of our latest issue of Seniors Today, so you just have an idea of what is there in the magazine.
Definitely.
So Seniors Today magazine, apart from the website, is published every 15th of the month. And it's an e-magazine which has been being published since July 2019. So we've had 31 issues already. And this is our flagship publication, as we would call it. And the latest issue has something called the 50 most influential seniors. And this is the cover of the magazine. And so this is an article on healthy and happy New Year. This is some of our regular columnists, remembering your medication schedule. This is a physiotherapist who's been here, Navneet Sahni is here. This is a regular article on music. So that's where Seniors Today magazine is there on the website. You can download it, you can access it. And as we all know, it is free of cost. That apart, the website exists in English and Hindi, so you can read both of them. Once again, it is free to access. Thank you once again, Dr. Punamiya, for this session, and thank you everybody for being here.
Thank you. Thank you very much. My pleasure. Take care. Good night.